Gastric surgery, preparing for surgery the right way. Any surgery, with the exception of emergency surgeries, should be planned for. There are many aspects that can be anticipated to make not only the surgery but the recovery period more effective, safer, and less painful. With any kind of gastric surgery, whether it is to repair a problem with the stomach or weight loss surgery, there are going to be changes in the way that you eat, even if these changes are only going to be temporary. If you are scheduled for any kind of gastric surgery in the near future, then it is a good idea to do your research, pay attention to your doctor's advice, and most importantly, be prepared for what is to come for you both just before the surgery takes place and during the recovery period. The more that you know and prepare, the easier it will be for you. A few months before gastric surgery, before the surgery is even scheduled, you should have at least one long informative consultation session with the surgeon going over the procedure itself and the options and alternatives. In addition, the surgeon should give you specific information about the procedure that relates to you and how you will be eating after the gastric surgery. For instance, after a weight loss surgery, you will typically spend several days or longer consuming only liquids, to give your stomach a chance to heal. After the liquid phase, you will move into a pureed food phase and then on to thicker textured food. After certain types of surgery, you will never be able to eat solid food ever again unless you are able to comply with all of the rules that are involved. Regardless, you will have a major change in the way that you eat, which is often a difficult adjustment to make and one that should be thoroughly prepared for by the patient and his or her family. Getting a support group in place should also be done during the months prior to the surgery. Not only will you need help getting around when the surgery is first completed, you will need moral support for the days when it feels like you cannot stand having the liquids any longer. If you do not have support in place, you will also not have the checks and balances that come with support from friends and family. Face it, part of the problem that led to a gastric surgery is your lack of self-control and your willingness to hide food or hide that you're eating. You cannot secretly get gastric surgery and try to still eat the way you did before, or you will be putting yourself at serious risk for infection and death. Finally, a few months before your surgery, you should start looking at the types of foods that you can eat and start getting a supply of them. You should invest in a good blender so that you can blend and puree your foods. Get a good set of measuring cups so that you can get the right amount in at a time. In the early days after your surgery, it will be vitally important that you follow the guidelines given to you about the size of your meals, or you will run the risk of popping your staples or ripping your stitches. The week before surgery, the week before the surgery is scheduled to take place, you should make sure that all of your paperwork is in order at the hospital, including all of your doctor's orders. Make sure that you get any blood work that is supposed to be done and that you have confirmed all of the times for arrival. You should also ask questions about what to wear, especially if this is not covered in the pre-op instructions. This is usually listed and might include guidelines to wear loose-fitting, comfortable clothing and not to wear jewelry or makeup of any kind. You might also be told to take a shower the night before using a specific kind of soap to wash with. You should also take this time to make sure that you have the time off, if required, arranged, and to get the right kind of foods in the house. If you know that you will be eating only liquids, it is necessary to get the right kind of liquids so that you are still getting the right nutrition. Some surgeons will have you start a vitamin supplement before the surgery so that you get used to taking it. In addition to vitamins, you may also need other nutritional supplements such as IsoMetricR, the smallest and most balanced, ready-to-drink meal replacement from Protica. Containing 2 servings of fruits and vegetables and 6 grams of fiber, it also provides 27 vitamins and minerals along with 6 grams of essential fatty acids. IsoMetricR is just over 3 ounces in size and comes in a number of different flavors. It can be a perfect way to ensure that you are getting the right nutrition while you are recovering from your gastric surgery. Immediately after surgery, when you are released from the hospital after your gastric surgery, you will be given a list of restrictions. You will probably be told to take it easy for the rest of the day and get lots of rest. Don't take that to mean that you get to go to bed and stay there for days and days. You will need to get up and move around, or you run the risk of developing pneumonia and other complications. When you are ready to start moving around more, the doctor will also give you guidelines for the right kind of exercise to do. You should also be prepared mentally for the changes that your body will be going through. After gastric surgery, your weight loss might be very rapid and you have to be ready for how dramatic this weight loss can be. You may need to have a few new items of clothing to wear, but do not be shocked if you have loose skin that keeps you from wearing clothes that are very much smaller than what you have right now. Finally, be prepared to call the doctor for any signs of infections or complications, any questions and concerns you might have, and pain that does not go away. If you eat the wrong foods or the wrong amounts of these foods, you will have pain and discomfort to deal with. Be educated on what you need and your gastric surgery will be much more successful.